Hello, a warm welcome. We appreciate that you're here. I'm Felicity Ezewike. Our slot topic for this segment has been described as the 8th most common cause of cancer-related deaths among women. Cases are predicted to increase by 42% globally and by 86% in Africa alone by 2040, and there is real fear a diagnosis is as good as a death sentence. But should it be? I'm talking about ovarian cancer. While the rate has significantly reduced globally in the last 20 years, recent trends suggest a rise, especially in Africa, with the possibility of figures doubling by 2040. As of 2020, over 17,000 women had died in Africa due to ovarian cancer. The death toll is predicted to increase by 51% in the world and 92.3% in Africa, also by 2040. This means that by that year, around 15,694 more women could be dead, almost double the present figures. Should an ovarian cancer diagnosis be feared as a death sentence for women in Africa? To help us with some perspective about the cancer, awareness level, challenges and treatment options, I'll be joined after this short break by Dr. Nonye Okoye. Do stay with us. Thank you for staying with us. I'm now joined live in the studio by Nonye Okoye, consultant obstetrician, gynecologist. She joins us from Lagos. She's here with me. Thank you very much for giving us your time.
Thank you for having me.
Let's start with a basic understanding of what ovarian cancer is and why this seemingly palpable fear that a diagnosis is synonymous with being given a death sentence.
Yeah, I think, thank you so much. I think it's really applaudable that you're bringing into fore this kind of talk. So ovarian cancer, as you may know, it's a cancer that affects the ovary. So the ovary are just, structures. If you watch on Instagram, you see people, when they see babies, they say, my
ovaries, yes.
They say my ovaries because, it's because of it's there for reproduction. So you have actually two, ovaries seated in the pelvis. That's just down around between your thighs. That's where the pelvis is. So ovarian cancer affects the ovaries, and it's there is a palpable fear. Yes, it's true, but you have to ask some questions. Why is there a palpable fear? Is it because people have lack of information, awareness? Do they have relatives that probably they present late to the hospital? And how do they feel? How are they managed? What is the information that they have? Could it be because of affordability, accessibility? So all of those things could contribute to why there might be a fear for ovarian cancer.
I guess we will come back to that.
Like every other cancer.
When we have maybe a little bit of understanding of where we're at. You highlighted a couple of things that could trigger people thinking that a diagnosis is a death sentence. One of them is awareness. What would you say we are in Africa and specifically in Nigeria? This is where we're domiciled.
Yes, so coming to the awareness aspect of it, if you do look at like in Nigeria here, where I'm in Africa, if you do look at the awareness in Nigeria, even in African countries, is like low to average. People don't really, they do know that there is cancer, there is ovarian cancer, but most of them don't even have the knowledge of the symptoms, of the risk factors. So even in developed countries, you see that one of the challenges in managing this condition has to do with presentation. So that's the main challenge we have, which is linked to awareness and knowledge. And so it's really a good thing, because if you're talking about prevention of medical conditions, even cancer, one key in management of these conditions, it would really be attributed to creating more awareness. So people could have more knowledge about this, what causes this, the risk factors, how can this be prevented, how can this be managed, and then you would see that you would ultimately reduce the death rate or fatality rate.
I know there's a couple of issues associated with this. I'm not, just basically from the little things I've read. You mentioned risk factors. Before we talk about prevention, what I did see was that it's not quite easy to identify when someone has ovarian cancer. I hear it mimics other symptoms. It is not just one thing. That maybe you have headache or you feel feverish, people automatically just diagnose themselves with malaria, for instance. So is that true, that the symptoms mimic different ailments that you might not be able to pinpoint that you have ovarian cancer? And if yes, are there specific tests maybe that can show you that you have this cancer?
Yeah, so I'll just take these questions one at a time. So you're asking about the symptoms. Yes, one of the problems, one of the challenges we do have from my experience with management of ovarian cancer, it has a lot to do with the symptoms. Now, if you also know that just if you compare that to other cancers, like ovarian cancer is the second most common gynecological cancer. I don't mean overall it's like the seventh, but I'm talking about genital cancer. After cervical cancer, you have ovarian cancer. Then firstly, apart from that, overall for women, the commonest is breast cancer. Now, the difference between ovarian cancer and these other two cancers I mentioned has to do with, accessibilities. The organs like the breast is easily accessible. You could easily, if you have a lump, you could easily feel that. Even at such, like, for instance, I went for a program like 2 weeks back on a Modern Sunday, and I had to talk to a population of women about breast and cervical cancer. So after that, I had to screen some women, and I just chose 5. And out of those 5 women, like 3 women had lumps on their breasts. And one of those 3 women, one of those 3 women, she had a family history of breast cancer. So does it make sense? So that's where awareness comes in. And this is about, organs that are accessible. Even the cervix, which is the neck of the womb, is quite accessible as well. Yet there are issues with presentation. Talk more of ovaries that are located, in the pelvis. So that is the issue. And adding to that, we have concerns about the symptoms are vague. So most of the times, sometimes women would even have no symptoms. Some would present with symptoms like abdominal pain, abdominal discomfort, bloating. Some women would present with satiety. That means early satiety. That means you eat a little kind of food and you feel, full and bloated. Some women could have pelvic pain, and at the late stages, they could have weight loss. So when they do have these early symptoms, in the past few years, they did say that these symptoms of ovarian cancer is really present when it's advanced. But it has changed because even in early stages, these symptoms are there. So that is where the issues are with regards to knowledge, awareness. You see some of these women.
As a doctor,
yeah.
What would make you ask somebody to go have a test, maybe, to confirm if they have ovarian cancer? And that's part of the question I asked earlier. Are there specific tests that will confirm that somebody has it?
Definitely, there are some diagnostic tests for that. But the thing about ovarian cancer is that, we are talking about screening. Like other health conditions or other cancers, there could be a pathway to screen for, these health conditions. For ovarian cancer, it depends on what the patient presents with. Like I said, these patients could present late. So when they present late, by the time you subject them to have some tests, some scans, special kind of scans, MRI, most times it may be too late. So when the patient comes to me, I would first of all ask the patient a couple of questions, ask them about their history, what they presented with, ask them about risk factors. Now, if you do tell me that you have a family history, if you know about a celebrity, Angelina Jolie, you know about her?
She had breast cancer.
Yes, not just that. She didn't have breast cancer. She had a family history of that. Her mother died of breast cancer. Her grandmother was affected. So she just went to she was just being assessed. That was about 2015. And she had a couple of tests done and a genetic test done, which one of it is we call it BRCA gene, which is an abnormal kind of gene that if you do have that, there could be a high chance that the person could have an ovarian or breast cancer. So because of that, she was offered some treatment options, which included to remove, her breast and the ovaries.
I think that's the part that I'm aware of, that she removed her breast.
Yes. So part of it will be assessing you, asking you a couple of questions based on your symptoms, based on your family history, some kind of lifestyle measures that you have. And then based on that, the doctor would refer you to do some couple of tests. And then from there, you could make the diagnosis and offer treatments to the patient.
You talk about family history, life experiences. What are these factors, aside the two, that increases a woman's probability of getting ovarian cancer?
Yeah, so surely, for every kind of cancer, really the cause is not clear. But they are like every woman, as long as you have an ovary, you have a lifetime risk.
Predisposition.
Yes. So there is a 1 in 70 background risk that every woman would have ovarian cancer as she is advancing in age. But then there are some things that increases a woman's risk. First has to do with some, like I've mentioned about genetic factors, which is very, very necessary, familial factors. Now, 10 to 15% of ovarian cancers could be linked to this. So you and I, every human being has, you have trillions of cells, you have genes that carry the information about how your cells work. So for any reason, if there is an abnormality or a damage to any of these genes, actually these genes should protect someone. But if there is a damage to any of these genes and this gene is being inherited from either of the parents, then you stand to have a risk of having ovarian or breast cancer. So we call some of these genes, one is BRCA gene, there is BRCA1, BRCA2 genes. So those are they are implicated in such cancers. Then other things have to do with, having someone being or having a high BMI, body mass index, obesity. So also some things that can be modified, like your age. As someone is advancing in age, there is a risk to that. Then alimenses, when a woman sees alimenses, because what happens is that the ovaries are egg baskets. They release eggs every month. So some theories, when this kind of thing happens, researchers tend to research to find what are the likely factors. And then the factors that have been there has to do with what we call incessant ovulation, when a woman keeps on releasing eggs. Now, when you release eggs every month, there are some damages that could occur to the lining of the cell.
It sounds really complicated. I'm sure somebody watching it for the first time might be wondering, this sounds really scary. So we've talked about the risk, the factors that may make somebody predisposed to ovarian cancer. So what are those factors or those lifestyle changes that
could reduce the risk,
maintain to reduce the risk of ovarian cancer?
Fine. The reason is not to scare anyone. That's the issue is that you need to give people the information so that they make informed choices. So it's not about scaring people, it's just to give you the right information. Now, there are some things that you cannot change, like your age. You can't change that. If you do have a family history of breast cancer, that can be changed. If you have a sister or a brother, or if a sister that had a breast cancer or ovarian cancer or a mother, you can't change that. But what you could do is that what are those risk-reducing strategies? So now coming to generally, like I said, lifestyle measures. If you do go to developed countries, if someone has any medical condition, the first thing they talk to you is about diet and exercise. So those are very important. So you have to watch what you eat. And that's where you have to go to maybe dietitians. They talk to you about if you have issues with maybe weight gain, exercise. It helps. It helps in the functioning of the body. Then for women, you advise them to breastfeed. Breastfeeding is good because there are some factors that interrupt ovulation process. So when you're pregnant, you have a lot of time. The ovaries are not releasing eggs. So it keeps the ovaries to some kind of resting phase. And that reduces the risk of ovarian cancer. So you exclusively breastfeed. If you are a woman and you have babies, so if you don't
let's pause and emphasize it. If you're a woman and you are having babies, please do exclusive if you can. If you don't have any reason not to, or you don't have any medical challenges, if you can, please.
So those are the ones that, then contraception. Some women, like if you do use some kind of contraceptive pill, like if you use combined contraceptive pills,
I read that as well.
Yes, it does. If you use that for over 5 years, 5 to 10 years, so studies have shown that it could reduce the risk of ovarian cancer to over 20%. But then you have to be careful because the COCP as well would increase the risk of cervical cancer. So you have to balance all of that and get the right information. And then there are some factors like some endometriosis, which is when you have an abnormal cells that is meant to be in the lining of the womb. It's in the ovaries, and use of some fertility drugs. So these are modifiable risk factors. So when you are exposed to such kind of risk factors, of course, you need to pay more attention to your health. You need to think more of if you have symptoms like bloating, abdominal pain, urinary symptoms, consistently, like you're having 3 or 4 episodes of that in a month. Of course, you should be able to go and see a doctor. Don't go over the counter, take some medications. By doing so, because part of reduction of these risks would be early detection and treatment.
I was just about to go there.
So that's that.
At the beginning, we talked about the fear that once you get an ovarian cancer diagnosis, you're almost as good as dead.
No.
And then there is the prediction that you have like a 5 years
survival rate,
and all of that. So
no, let me come to that. People read a lot of things in the internet. Now,
no, but there are research that I understand that gives you. So, okay, basically what I want to ask is it treatable? And is there a possibility that after treatment, the person can go on to live the full span of their life? And at what stage? Because I know it's in stages. Stage
one, two, three, four, yeah.
What stage is it? If you catch it, what stage will you catch it and you can have that chance?
Yes, for every cancer, once it's the cancer, all the cancer stages usually are from the way it's being called. We have what we international staging system we call FIGO, is from stage 1 to stage 4, right? So for every cancer, once you're in stage 1, it's an early cancer. So those are really amenable to treatment, cure, and the survival rates are higher. So when you're making all those research works like in Africa, we do have survival rates for stage 1 cancer. That's the early cancer. It's over 80 to 90%, because most of these researches, they don't go further than 5 years, right? So overall, it's about 40%. So that means that if these women, they have the treatment, they are seen in 5 years during the research period, they are doing fine as long as there are a lot of factors that affect the treatment. It's not just about treatment, it's about the age of the patient. Does the patient have any medical condition? What are the kind of risk factors the patient has? At what time is she presenting? What the team of experts managing the patient? What kind of facilities do they have? Those are the questions that you have to ask, and those are the factors that affect the treatment outcome for every kind of cancer. Okay. And of course, the patient's outlook.
Yes, that's the mental state as well. That's why you people always harp on mental health and how it impacts on healing.
Yes.
I want you to speak on, we talked about, I asked you at the beginning about awareness. What level of awareness do we have? How do you think we can improve on awareness? Because when we do that, the diagnosis might become easier. More women will be more conscious of needing to check themselves and know that there's a likelihood you could have this. What can we do to improve?
What you're doing now.
But this is, yes, News Central is Pan-African, yes, but there could be more. It's not everybody that has a television.
Now, let me tell you something. There was a study that was done in Louth, I think 2018, and they tried to assess the knowledge of the participants, over 400, and to find out the knowledge and awareness of, they have about ovarian cancer. It was done in Nigeria. So about 19% of women had the knowledge, you could see how poor it was, had the knowledge of the risk factors and symptoms of ovarian cancer, and then the sources of the knowledge. Like about 33% of such women had the knowledge from mass media. Okay. Television.
So we're doing a work.
Instagram. We're doing a good work. So Instagram, social media, and about 30% also had knowledge from just discussion with their
fellow women.
Doctors.
Oh, okay.
So they come to the hospital, they ask a couple of questions, they talk to them about ovarian cancer, and they get to know about that. Or from relatives, just social media, they have a relative that had this kind of condition, they had to read it up, but mostly from health professionals, just like I'm doing now. So that's a very important way of spreading awareness. You just have to go through a mass media, disseminate the information. And also, if you do have survivors, because there is this stigma people have about sociocultural reason, factors that could affect them. Some people, when you have a family history of cancer, they don't want to talk about it. So if we do have like celebrity survivors, people that people look up onto, and they have this kind of condition, or they have a relative, they could just, do a campaign.
Do we actually still have cultural stigma about things like this?
Absolutely, we do have. May not be in some parts of African countries, even in Nigeria, like in the northern countries.
Why is that? Why do you think?
Yeah, it has to do with development. Okay, it has to do with education. A lot of things that has to do with socio-cultural factors has to do with education. Although if you do conduct a study in cities like Lagos, where I stay, you would find out that over 50% or 70% of women, they have tertiary education. And those are people that have less chances of having this condition. Now, if you get to the northern parts of Nigeria, you will find out that a lot of women, there is this issue of patriarchy, where they have to take permission from their partners to come to the hospital. even now, you would see women who have medical conditions, they do not have money, they are not working, poverty, it plays a huge role. It works hand in hand with sociocultural factors. Some people, okay, talking about these factors as well, some people who have this condition, you would see some women who are learned, they get to the church, they believe, they keep on praying. No, I'm telling you what I see from experience. They get to the church, they keep praying, this happens for like a year, they later come to you. Some would take some supplements, GNLD products, because some would go to take over-the-counter medications, treating ulcer and all of those symptoms. By the time they come to the hospital, it's really, too late.
What more can we do? What more can we do? How can we reach these people in the hinterlands who might not have better access? Is it maybe, you talked about something about husbands who who might not give permission. Is it not possible to also educate the men to be aware that if you have a spouse who might not be as exposed as you need to help them to make these checks?
Yes, what we can do generally, like you said, for every medical condition, like you could start from the grassroots. If you have the information about any condition, you educate somebody around you, the person educates somebody around him or her. And then we have issues with, political...
I was actually looking more specifically at spouses, partners, men in particular, who may have partners who are not as enlightened
as they are.
Yes.
So what can be done to those?
How can we educate these people? Because sometimes some men don't know about these things. While others educate themselves, there are those who don't.
They are what we can do is that we try as much as possible to involve men in issues of women. Like when you are a woman, like you see some women, when they come to me, they have a health condition, or even pregnant women, or any issue. They want you to, their husbands probably don't want to come with them. So you have to actively get the husband involved. You have to tell the person, or you have to take the phone. You tell the husband, see, your wife, she has a serious condition. I want you to come. And when they listen to your voice, they come. So in any way you can, you just actively get their partners involved.
Okay.
And then we need, then political will is also very important, because one challenge that we also have has to do, now if we do have, politicians, because they are so distracted with a lot of things happening, the issues about security, political instability, and less attention is paid to, cancer. So if we do have them trying to, or even NGOs sponsoring campaigns to enlighten people, even in such remote areas, it will go a long way to drastically reduce the burden of.
I wish we could continue the conversation. So I'll just give you like 30 minutes to.
Yeah, it's okay.
What would be the key reminders you would want our viewers to take away from this conversation as we wrap up?
Yeah, the key reminders I would want them to take away is simply that health is wealth. You have to be healthy to live long. You have to be healthy to achieve anything you want to be in life. Ovarian cancer is real and is becoming a scourge. And patients are being lost because of lack of awareness, lack of knowledge. And so trying to educate patients, anybody who is listening to me, try to pay more attention to your health. If you do have such kind of symptoms, or if you do have a risk factor, we even have genetic testing where you could approach the oncologist and they could talk to you about genetic testing, where you could be tested to find out if you have these abnormal genes that could increase the risk of you having a cancer.
Yeah.
So,
and the heart of it is try as much as you can to be aware and live a healthy life. Thank you very much. We appreciate your insights.
Thank you so much. Thank you so much for your time. Yeah.
All right. Thank you for staying with us this long. We're not done yet. We'll go for a very short break. And when we come back, we'll be going to security matters, taking on the situation in Niger and the U.S. concerns about a recent decision by the junta. Stay with us.